Dr. Guiseppi Elie came to America in 1980. He gained a doctorate from MIT and eventually found his way to Clemson University, where he now studies biochip technology.
My background is in bioengineering, specifically biomolecular engineering, and that is the manipulation of biologically active molecules. I've been at Clemson University now for 2 years, and prior to that I was at Virginia Commonwealth University in Richmond, Virginia, where I was a professor of emergency medicine and professor of chemical engineering. The notion of implantable sensing devices has been around for some time, and indeed there are lots of examples of really good literature, scientific literature on the subject. And so we are building on the shoulders of giants who have come before us.
Dr. Guiseppi and his team hope to further the field of biochip technology by studying how to maintain viability in a longer-lasting biochip.
That's a basic science question. And so my students and my postdocs and my colleagues in the center are involved in answering that kind of question. Do we design new materials? And if we do, what sort of approach to these materials should we take? If we design new materials, should these materials have particular kinds of chemistries or particular kinds of topographies or certain kinds of shapes that would give them extended viability in the human body? So these are the kinds of questions we try to answer. In the final analysis, it is about having a device that can change outcomes in the clinic. Having a device, if it were available, to help physicians, clinicians make better decisions about how to resuscitate, who in mass triage situations, who needs what kind of care. This kind of information would help. So a chip is a good way to do that. I think the main goal should be to achieve an indwelling device that could make measurements in the body for a period of about 6 months. The center that I direct is broken up into several laboratories.
The research team uses their Advanced Research Center to study and test their advances in science. Like any scientific field, they have many challenges to overcome in achieving their goal.
So we really have to work very hard in understanding the physiology, the immunochemistry, and the materials, bio interactions, so as to design better materials that could survive for this length of time without provoking the body's foreign body response.